I just want to begin by thanking Sinn Féin for putting forward this motion and giving us all an opportunity to discuss such an important issue, and Social Democrats will be supporting it. 64 million of additional expenditure for investment in disability services. I didn't believe it when I first read it in the budget document. Such a pitiful investment into improving services with so much unmet need. I and my team poured through the budget document to see if we'd missed anything, and then I listened to yourself, Minister, at your press conference to see if you could bring any clarity to the matter, only to hear you announce a 195 million package for disability services. The Minister for Finance then on prime time announced that the government had provided around 200 million of increased expenditure for disability, a figure which was absolutely nowhere to be seen in the budget documents that I received anyway. And a day after the budget then we received clarity. The ministers had been including funding for existing services alongside new expenditure, all to make the disability budget look bigger than it actually is. Despite all the spin, the level of investment was exactly as was outlined in the budget, 64 million. That figure represents an abject failure by the government to invest in our disability services, a failure to address the unmet need in the sector. Week after week, Minister, and I've been in here many times with you, and we raise the crisis facing the disability sector, and every time we're met with the same kind of rhetoric from government. And that's kind of of course you care, of course you're doing everything you can to improve the lives of disabled people, and kind of a how dare we even question that rhetoric. But I will question that. And the question I have to ask is, if the government won't invest in disability services with a €14 billion budget, when will they? When does this government intend on taking responsibility for the people with disabilities? Because honestly, I've genuinely lost faith that this government ever will. The Disability Capacity Review, published in 2021, quantifies the current and future need for disability support services. One of the key issues highlighted was, and I quote, significant levels of unmet need for disability services, and that changes in size and age profile of the disability service population will add to unmet need over the coming decade. Addressing demographic change alone would not be sufficient, as the current levels of unmet need is not sustainable. So there's a need to spend between 550 million to 1 billion extra each year to meet the needs of a growing and ageing population between now and 2032. This funding is needed for residential services, for supported housing, adult day programmes, multidisciplinary therapy services, personal assistance, respite, the list goes on. The Disability Capacity Review outlined the situation, and it was up to the government to respond quickly and sufficiently. There have been 3 separate budgets since that review was published, and none of them have come close to meeting funding targets. Government have had the opportunity, time and time again, to provide the funding to make long-term improvements to disabled people's lives, and every time the government has passed. There isn't any kind of a plan since those 3 opportunities have been passed up to do anything about it. In April last year, the Minister for Health informed the Dáil that a working group tasked with developing an action plan for the period 2022 to 2025 had completed its work. A year and a half later, that action plan has not yet been published. Where is the plan? Where is the urgency to meet the unmet need, not to mind future need? The Social Democrats allocated a total package of 534.1 million for disability services, ensuring adequate funding for the huge capacity gaps that exist in services. We also would have introduced a €30 weekly cost of disability payment, in addition to the core increases in social welfare rates. The government's own cost of disability report revealed that people with disabilities face up to 12,300 extra costs annually on transport, fuel, equipment aid, medical expenses and much more. Additionally, this report was done before the current cost of living crisis, and I think we all know that for many people the added cost of having a disability is far higher than 12,300 a year. There's a substantial cost, added cost to living with a disability in Ireland, the impact on individuals and families' quality of life. It also impacts on future prospects for people. It's now 10 years since the then Fine Gael and Labour government axed the mobility allowance and the motorised transport grant. At the time, the then Minister for Transport, Leo Varadkar, promised replacement schemes would quickly be launched. A decade later, those replacement schemes are nowhere to be seen. The same lack of urgency apparent in the implementation of the Disability Capacity Review has been very clear in relation to the government's treatment of Section 39 workers. The Social Democrats have always been really clear that we support pay parity for community and voluntary workers who provide so many of our vital disability services. Pay parity for these workers was somehow completely absent from the budget. I'm really glad that the strike this morning was averted, but I think it's really important to note that the whole matter was completely avoidable. Section 39, 56 and 10 workers went to the WRC this year along with the state as the paymaster and were offered a 5% pay rise by the state. This insulting offer was rightly rejected by the unions. The pay differential between Section 39 workers and HSE workers is estimated to be between 10 to 20%, depending on the role. There was also no offer to link their pay to the public sector, which means when the public sector pay goes up, generally yearly, Section 39 workers fall further and further behind yet again. Those talks broke down in July. Unions repeatedly made it clear to the state that they were willing to negotiate further, but the government refused to engage. Left with no option, the workers balloted for strike action and gave the government 21 days' notice of industrial action. But again, the government refused to engage. People with disabilities, older people, carers, and Section 39 workers themselves were in an incredible amount of stress over the potential of strike. No one wanted to be out in the picket, but no other option had been made available to them. I was on the Upfront show with Katie Hannon last night listening to people in the audience who didn't know if their PA would be there this morning to help them out of bed or to help them get to work. Martha, a healthcare assistant from Cork, was on the show and she described an older patient she has asking her if she would even be able to get a bowl of soup tomorrow. One would be forgiven, I think, for taking a very cynical reading of the department's decision to wait until the last possible moment to re-engage in negotiations, after people had been put under an incredible amount of unnecessary stress and anxiety. While I haven't seen the full detail of the proposal to workers, what I've read is a pay increase of 8%, which falls below pay parity. The serious problems with recruitment and retention for the sector will continue for as long as there is a pay differential. The turnover in the community and voluntary sector is around 30% yearly. They're hemorrhaging staff to the HSE, and agencies are spending a huge amount of money and resources on recruitment. This adds to the long waiting list for services. The terms of the proposed settlement will now be put to the membership of the unions for consideration, but the Minister must ensure that what emerges at the end of this process is fair and sustainable. I cannot see a way for that to occur without complete pay parity between Section 39 organisations and the HSE. And Minister, time and time again, you've come into the Disability Matters Committee. We hear from people week on week in that committee about how their lives are torn apart, ruined, missed opportunities for early intervention, which is the key thing really in terms of whether or not you can live a full independent life going forward. And when the department come in, when the HSE comes in, indeed when the Minister comes in, what we ultimately get at the end of the day is a kind of a, well, throwing the hands up in the air, we can't recruit the staff, and that's ultimately where the biggest problem lies in terms of access to, treatments under the Children's Disability Network teams, all of those things, and we're told the millions of euro that's been pumped in to trying to recruit staff for the CDNTs and other disability services. And then we have a situation, there's a €14 billion budget. The biggest issue of staffing in the sector is the fact that there isn't pay parity, and this isn't addressed, not even mentioned in the budget. So, Minister, I think it's fair to say people genuinely believe when you come to meetings in all of our constituencies and stuff that you do care. Everyone can see that. But when there's a budget that doesn't allocate anything for something like that, that has 64 million, genuinely thought it was a typo, it's difficult to believe that this government is ever going to take the necessary steps to meet the unmet needs of disabled people in Ireland.